Hi, I'm Dr. Rick Duplantis, and I want to welcome you to my show, It's Your Health. Tonight's topic is about diabetic neuropathy. Diabetes has reached epidemic proportions in the United States at this time, and there's a relationship to obesity with type 2 diabetes. I want to give you a few points on diabetic neuropathy tonight and let you see what are the predisposing risk factors for this condition and ways that it is treated. So we'll go to my slide presentation at this time on diabetic neuropathy. Peripheral neuropathy is the most common type of diabetes-related neuropathy, occurring in 1/2 of the diabetic patients. This affects the toes, the feet, legs, hands, and arms, causing a loss of sensation or pain in those extremities. Recent studies show that the spinal cord is involved in peripheral neuropathy, that nerve damage starts in the foot but will affect the entire nervous system over time. The lumbosacral plexus neuropathy and the diabetic amyotrophy are other names for this proximal neuropathy. Among patients with the same degree of neuropathy, some experience more pain than others. Pain is mediated by these small fibers which may be damaged or destroyed in diabetic neuropathy. This results in a loss of sensory loss. However, these small fibers have the capacity to regenerate and to lead to ectopic generation of impulses and hyperexcitability, resulting in a highly painful neuropathy in some patients. Moreover, pain nociception is a complex and involves various factors. Patients with normal results on clinical examination and have small fiber testing can also experience a painful neuropathy. Around 20% of patients with diabetic neuropathy actually experience pain, of whom 5% are considered very badly affected. Among patients who undergo amputation of a diabetic foot, the 5-year survival is only 50%. In some cases, the mortality rate has been estimated to be up to 85%. The peak incidence of amputations has been observed between 67 and 76 years of age, and the risk for amputation of the opposite leg after a first amputation is 42% in the first year, rising to 56% at 3 to 5 years out. Early diagnosis of a diabetic foot and proper management with a multidisciplinary team could prevent 1/2 of those amputations. Peripheral neuropathy is the most important factor leading to foot ulceration. Although a certain number of neuropathic patients may be completely asymptomatic, they remain at risk for foot injury and subsequent ulceration and amputation. According to the 2014 data from the Diabetes Control and Complications Trial, the epidemiology of diabetes interventions and complications, men with type 1 diabetes mellitus and diabetic peripheral neuropathy have about 4-fold increased prevalence of erectile dysfunction, as well as nocturia, urgency, and other urinary issues compared to those without neuropathy. An analysis showed that the range of erectile dysfunction is associated with age and the hemoglobin A1C value. But within 5 years, the likelihood of returning to normal erectile function decreases with every additional year of reported erectile dysfunction in these patients. That tight glycemic control in patients with type 1 diabetic mellitus reduced the occurrence of clinical neuropathy by about 60% in 5 years. This is according to the Diabetes Control and Complications Trial. But whereas strict glucose control can stop diabetic neuropathy in type 1 diabetes mellitus, it appears not to be enough to ameliorate the onset and the progression of the disease in patients with type 2 diabetes mellitus. One of the reasons could be that the neuropathic process starts early in type 2 diabetes. The underlying mechanism for the development of neuropathy in type 1 diabetes and in type 2 diabetes also appear to be different, and the management should start as early as possible. All the conditions such as kidney disease, diabetic nephropathy, obesity, and smoking, among others, have been identified as risk factors for the diabetic neuropathy condition. Neuropathy is a microvascular complication of diabetes and therefore lends itself to cardiovascular risk factors such as hypertension, being overweight, smoking. All of these can contribute to the disease, and they do so. The constellation of these increased risk factors for cardiovascular disease as a result of having diabetes, you add hypertension, smoking, obesity, and this accelerates the progression of diabetic neuropathies. Alcohol abuse, inflammation, and genetic factors may also be involved. In kidney disease, the increase of toxins in the blood may promote nerve damage. Poor glycemic control and the duration of diabetes remain clearly important predictors. There's no known cure for diabetic neuropathy. The treatments for diabetic neuropathy are mostly symptom relief. They do not address the underlying nerve damage. These treatments focus on slowly progression of the disease with tight blood glucose control, regular surveillance for injuries, checking the feet, and a lifestyle intervention. Relieving pain and anti-seizure medication and antidepressants. The alternative treatments such as capsaicin, alpha-lipoic acid, transcutaneous electrical nerve stimulation, a TENS unit, acupuncture are all being used, but efficacy varies among patients with the types of pain that they're experiencing. Managing complications and restoring function with specific treatments, targeting urinary and digestive problems, in the orthostatic hypertension, and the sexual function all are addressed. The most important multi-modal approach seems to be the most efficient management of a painful diabetic neuropathy. Teams including physicians, nurses, podiatrists, psychologists, physiotherapists, and pain specialists should target not only glycemic control, but they should focus on lifestyle changes, pharmacotherapy, and other neuromodulation, assistive devices, and physical, behavioral, and complementary therapies. Lifestyle changes, that's what we have control of. I always say that we are in control of our health. We're going to pay for health care. We can pay for it in the way of prevention. We can pay for it in the way of treatment. The ounce of prevention, the pound of cure applies here. If you can exercise, improve your lifestyle, this will go a long way in preventing this type of condition. Diabetes is a condition that affects many areas of the body, including the patient's feet, legs, and hands. Diabetics who suffer from numbness, pain, and loss of sensation in the extremities, this is what peripheral neuropathy is. This diabetic peripheral neuropathy is traced back to uncontrolled blood sugar. Poor diet and not taking your medications on a regular basis. It's estimated that over half of the patients diagnosed with diabetes will experience peripheral neuropathy at some point in their lives. Neuropathy can be very painful, but the condition generally starts with a slight tingle or numbness in the legs, feet, or hands. Many describe the sensation as prickling or buzzing. As the condition worsens, it begins to feel like a sharp pinch or burning. As the muscles weaken, patients may be more likely to lose their balance when standing or walking. Patients who have debilitating peripheral neuropathy in the legs and feet will require a wheelchair, a leg brace, and splints. Diabetic neuropathy cannot be cured. However, the underlying issues can be treated. Pain management, as we mentioned, is also available. Common forms of treatment or the medication management, like I said, the physical therapy, a approved diet, an approved exercise program of walking and strength training, and alternative therapy such as acupuncture, also spinal cord stimulation. The painful diabetic wound, there are many medications on the market for diabetics with neuropathic pain. The topical treatments available, over-the-counter prescription drugs like Topamax, Lyrica, just to mention a few, even with primrose oil, and the proper alternative treatments. But some patients have also had relief with acupuncture and massage therapy for their diabetic neuropathy. The best thing a diabetic can do to rebuild muscle is to keep new nerves healthy, is to adopt a healthier lifestyle. You know, I keep continuing to reinforce the value and the importance of exercise in your life. Diabetics have always been told to watch their weight and become more physically active. This is your lifestyle, folks. You're in control. Your doctor can't do that. You can't take a pill for a diet. You can't take a pill for exercise. You can't out-exercise a bad diet. Exercise will not overcome poor lifestyle choices in a bad diet. Diabetics should also take their diabetic medication as prescribed by their doctor. They should avoid alcohol, which changes the sugar in the body. Patients should also stop smoking that are diabetics because it constricts blood vessels that should be feeding nutrients to the peripheral nerves. This smoking might enhance your peripheral neuropathy and may put you at further risk for amputation. It is also important for patients to test their blood glucose regularly. Physical therapy is another option available for diabetics suffering from leg, arm, or foot pain. Occasional occupational physical therapists can work in patients to rebuild muscle and help them find solutions to everyday problems stemming from physical limitations. Fortunately for diabetics, slightly damaged peripheral nerves are able to regenerate. This means that those who are just now experiencing these early symptoms have the best outcome for treatment, but they must aggressively address this personally. Now, the concept that the pill fixes diabetes is wrong and does not work. We know that in medicine. The individual must change their lifestyle. They must lose the weight that they have. They must stop smoking and embrace an active lifestyle of exercise. In conclusion, this peripheral neuropathy is very serious business. It affects many diabetics. Early symptoms are often ignored. However, it's important to act quickly to limit nerve damage. There's a variety of ways to treat these symptoms, as we have gone over some of them for you here. I'm Dr. Rick Duplantis. And each and every week, we bring you new topics on health and give you information to help you control your health and determine your future, and assistance and prevention of many of these chronic disabilities. I want to thank you for tuning into my program tonight, It's Your Health. I hope that I've given you some information on diabetic neuropathy, how it's treated, how to prevent it, and how to minimize your damage if you are a type 1 or type 2 diabetic from a healthy lifestyle, an active lifestyle of exercise, weight loss, and healthy choices when it comes to your diet and your nutrition. I want to wish you a very pleasant good evening. I'm Dr. Rick Duplantis. God bless.